I'm Pam Sherman. I'm one of the orthopedic surgeons, and I do hand surgery at Cook Children's. And we are at the TCU Rec Center today with a group of our congenital hand and upper extremity kids doing a rock climbing event. Now that the pandemic is kind of coming to a close, we've had the opportunity to bring all of our kids together, and we've got a group of about 8 kids that have signed up to climb the rock wall, and each of them has a hand difference or a disability or difference with their hand, and we're climbing with a bunch of TCU students who are helping. So this is a great community event for us, for Fort Worth, to sort of support what we do with our patients and for our patients to feel empowered. And if you've seen the video, it's pretty unbelievable watching them. You actually have to look and see which side is the involved side, because it's hard to tell as they're up on the wall. It is amazing. Actually, we were sort of talking, a lot of these patients have started with us as babies, and a few of them have walked in. We haven't seen them in a year or so, and we're sort of shocked at how big they are, but most of everybody on the wall has been with us since they were infants, which is really fun to watch. So when these kids come in as babies, the parents are really overwhelmed. They have kids that have been born with some difference, and a lot of times parents will say, will my kid be able to live a normal life? What will happen? And I always encourage them to appreciate that that difference is their something, and that they will figure out their something and how to deal with life and manage. And they actually often are better than a kid without a difference, because they've learned how to handle a challenge and move on. And this is exactly that. Rock climbing is using your hands, and some of these kids have no fingers. Some of these kids are missing a portion of their limbs. Some have spasticity and can't grab. And so it's really amazing to see them using their hand and showing them that they actually can do things that no one would think with looking at it would work. And it really is a way for them to feel empowered, for them to see that it's different but it still works, and for them to see that they're not the only ones. The other part for us is each one of them typically are the only ones in their community, but in my hand community they are the one of many, and so to be able to see other kids that have what they have and climb and interact is really helpful.